We can start with introductions. For those of you that don't know, I'm really happy to see the African Diaspora Mental Health Association here. Chelsea, you just want to introduce yourself really quick and just say who you are, where you're from, and why you're here.
Sure. Good evening, everyone. I'm Chelsea Bryant. I'm the Vice President of Behavioral Health and Recovery for Gandara, and I'm here to become involved and get Gandara involved in some of the initiatives coming from this committee. Thanks for having me.
Thank you. Angelica, you're next on my screen.
Good evening, everyone. I am Angelica Rodriguez. I work for the Department of Children and Families as a supervisor. I have been with them for 17 years, born and raised in Springfield. So I'm committed to this initiative, both as a community member and as one who serves families and children across the region and state. Thank you for having me.
Thank you, Angelica. Ms. Barbara Gresham, School Committee Woman, Barbara Gresham.
Yes, good evening, everyone. I'm on the school committee and I am chair of student and parent concern. So I know there's a lot of concerns out there about mental health. So I just want to be a part just to see how I can be instrumental in helping with our students with respect to mental health.
Thank you so much. It's vital, vital.
Yes, it is.
And Mr. Gary Porter.
Hey, I'm driving. Could you hear me?
Yes, we can hear you.
Okay, thank you. Thanks for having me. So my name's Gary Porter. I know some of the people on there, but I'm from the African Diaspora Mental Health Association. We're located in Springfield. We're perhaps the only mental health agency that's opened up specifically to deal with issues as it relates to people of color. And we have, I don't know, I think our count's probably about between 25 and 30 therapists of color. So we're glad to be here.
Thank you so much. Thank you. And Beverly, do you want to say something about your business? If you want to tell people.
Sure. Hello, everyone. I'm Beverly Guerrero Porter, and I'm the digital content strategist for 717 Media, which is my startup providing social media management and digital marketing consultation services for businesses. And I'm happy to be here tonight supporting Zeta, Councilwoman Govan, and taking notes tonight.
Yes, thank you so much. Thank you very much for being here and for helping us out. Ms. Ayana Crawford.
All right, thank you so much, Councilor Govan, and good evening to everyone here. I represent Representative Orlando Ramos's office for the 9th Hamden District. We're excited to partner and certainly be a part of sort of the initiatives and certainly legislative wise in terms of how we can push legislation around mental health awareness and more importantly around our young people in our schools. So excited to be here and certainly willing to help in terms of helping to pass and recreate, if you will, legislation around mental health. So thank you.
Thank you very much. Pastor Nick Munn.
Hi, so I'm Pastor Nick Munn. My wife, Karen, and I co-pastor Orchard Covenant Church, which is in Indian Orchard. But I'm a licensed mental health counselor. I only started pastoring a couple of years ago officially. But and I did in-home family therapy. I did school-based health centers. I've done outpatient. So I've 15 years under my belt for mental health. So it's something I care about. And our church cares about it. We're the type of church that thinks that we should also do stuff and not just talk. And so we try to put some action to our faith. And so I'm glad to represent both my interest and care for mental health as well as represent our church.
Thank you, and thank you for being here. We were just talking about the church yesterday, actually, at a meeting that I was at. Nicole Desnoyers.
Hi, thank you so much for having me here tonight. I am a parent in the community. I raise 3 children who all 3 have their fair share of difficulties, but we've experienced a lot. So I'm happy to bring forth the parent perspective and where we can kind of help build our youth up.
Yes, thank you so much. And that is a very important piece that we need to hear from. Thank you for being here. Sarah Kendall.
Good evening, everyone. I'm Sarah Kendall, Vice President of Clinical Operations with Golden Years Behavioral Health. We are very excited to see how we can partake in the initiatives. So I'm happy to be here.
Thank you so much. Cynthia Swan, First Lady.
Hi, Cynthia Swan, licensed eligible, licensed mental health counselor. What else was I gonna say? We're looking forward to opening up my own practice and being one of those other resources in the community, specifically dedicated to people of color. I think that's pretty much it. I'm a community member. I'm not here representing the agency that I work for. I'm here representing myself and my family.
That's great. That's another very important voice. Kathy McHugh.
Mute button. Hi, I'm Kathy McHugh. I'm with BHN, Behavioral Health Network, and love to participate in dialogue with collaborators across the city about how we can break down silos and bring services to the people who need it in a way that meets their needs. So super excited to be here.
Awesome, and I'm really glad to have you. Tracy Carpenter.
Hello, everyone. I'm Tracy Carpenter. I'm with Mass Senior Action Council. I live in the Forest Park area. Just found out about this subcommittee group. Councilor Govan, excited to kind of learn a little bit more about it. Initially, I think I've come across the mental health crisis in terms of looking at public safety, and I'm greatly concerned about having options and alternatives and safe places for people who are in trouble. And we know that the police cannot do it all and haven't done a great job here in this city.
Thank you very much. Tiffany Rufino.
Good evening, everybody. It's great to see so many familiar faces. My name is Tiffany Rufino. I'm the Youth Mental Health Coalition Manager, which is convened by the Public Health Institute of Western Mass. And I'm just really excited to be here to learn about all the other groups and folks that are here in support of youth mental health, and to help ensure that the Youth Mental Health Coalition is strategizing and creating initiatives that really speak to the needs of the community. So looking forward to meeting with you all.
Thank you so much. Thank you very much. Teresa Glenn. Oh, you're muted. You're muted, Teresa.
Okay, can you hear me now?
Yes, ma'am.
Good. Okay. Hi, I'm Teresa Glenn. I work at the Springfield Department of Health Gambling Prevention Program, but also have a deep interest in and history and experience with mental health in the community level, and very interested in the public health perspective to addressing mental health issues in our city. I'm a Springfield resident of 25 years in the Forest Park neighborhood. And that's me.
Thank you. Thank you, Teresa. Tim Allen. Counselor Tim Allen, I apologize.
That's all right. All right. Not necessary, but thank you, Zaida. Counselor Govan. Hi, I'm Tim Allen. I'm on the city council with Counselor Govan. I represent the whole city. When you're on there, you represent everybody, but I'm elected by the people who live in Ward 7, which is East Forest Park and kind of the Allen Cooley Outer Belt 16 acres area. And I made the first one of these a couple months ago. I couldn't make the second one, but I'm just interested in mental health and doing what I can to help. It's a major issue, and would like to help Zaida be able to get something done here.
Thank you. Thank you, Counselor. Malika Jeffries.
Hi, good evening. I apologize for my tardy. I was just in another meeting. I am Malika Jeffries, and I coordinate a Drug-Free Communities Coalition through the Gandara Center, the Stop Access Coalition. And we work to prevent and reduce underage drinking, youth use of marijuana, and tobacco-related products. And substance use goes hand in hand with mental health. So that is why I'm here.
Thank you so much. I appreciate you being here, Malika. Christine Tatro.
Hi, I'm Christine Tatro. I am also driving, which is why I have my screen turned off. Don't want to give anybody motion sickness. I am a special education attorney. I represent families of kids with disabilities. Mental health is both a professional and a personal concern of mine. And so when Zaida said she wanted to start this committee, I was very excited. So I'm looking forward to hearing what so many people have to contribute to this topic.
Much. Thank you, Christine. And last but not least, Ms. Della Blake, Mrs. Della Blake.
Good evening, everyone. My name is Della Blake, and I'm here representing dual capacity. One, I am the director for the Black Addiction Counseling Education Program, and we are a workforce development program designed to provide the certified education units to individuals interested in becoming certified and licensed addiction counselors. The target population is African Americans, qualifying African Americans in the field of being certified and licensed addiction counselors. And I'm also chair founder of a Black Behavioral Health Network. And we are offering comprehensive and culturally appropriate behavioral health services to men and women, and committed to guided recovery, to enable people to realize their full human potential. We're looking at working with reentry populations coming out of the criminal justice system and supporting their transition efforts successfully by helping them with those supports that will help them do so: employment, mental health services, housing, all the challenges that exist for African American populations, specifically those challenges that emerge as a result, of being Black. So we're trying to support those populations coming back into community.
Thank you. Thank you so much. And thank you so much for being here. And thank you everyone for being here. I really appreciate the community and collaborative effort that we're making here. And that's the reason that this mental health subcommittee was started on the city council. It was initially in response, of course, to a tragedy that happened earlier this year with Mr. Orlando Taylor and the police and crisis services. But I believe that because that was what started it, but I don't think that that's what's going to finish it, right? We're all here trying to find a solution to the mental health crisis that has evolved over the last 10, 15, 20 years, I would venture to say. As someone said yesterday, I think COVID really just took the covers off and just exposed all the mental health issues that are out there currently. So I'm very excited to be here, and thank you all for being here. So when we started this committee, the reason that we're doing this, for those of you that don't know, is that we're meeting for 6 meetings, and we're coming, talking to everybody that we can talk to. And in the end, we're going to come up with a report and some recommendations for the city to move forward with some solutions that will produce positive outcomes for our community, for all of our community. So I'm hoping that that's what we're going to be doing. I was so excited to yesterday to have met the First Lady of New York, Mrs. Shirlane McCrae, who's been here for the last few days, and Kathy was in that meeting. And it was just so exciting to hear the solution that she said is collaboration. And that's what we're doing here. And I think that that's what the city needs. We need to all work together to come up with a solution, you know, and not one person can do it all. I think someone alluded to that in the speech, Ms. Tracy. You know, the police can't do it all. You know, one agency can't do it all, but I believe that if the entire city comes together, we can do it all, and we're going to do it all. So that's why we're here. So at this time, I would open the floor to some discussion, I guess. One thing that you'll find out about me is that I'm on time. So we're gonna end at 7, or if we're done by 7, we'll end before 7, but we'll end for 7 o'clock because I don't wanna take up a lot of your time. Time is valuable, and I just wanna make sure that we get through what we have to get through. I don't think that we sent an agenda out today, but I want to come up with what we've been talking about. Does anyone want to talk about the mental health checkup day that we actually started planning? One thing, I'm a professor at college. I don't like to do speeches either, so I like people to talk. Angelica, you want to talk a little bit? You were at the meeting when we were planning it.
Yeah, I'd be happy to. So yeah, we came together about almost a week ago to talk about this mental health checkup day, and some of the things that came up for the entire group was really what can create a space of welcoming, right, and of beginning to create dialogue and connection with our community, because this is going to be an initiative that isn't just a one-time thing, but a continuity of care and communication across getting back to the basics. How are we doing across our professional roles and as community members, right? First responders and those providing mental health services, and the families and children that comprise of our communities. So we spoke about having a launch off June 29th, I believe, from 11 to 3. In downtown around City Hall, I believe it was. And from there on, creating a resource card with all of the agencies represented that you got to meet on June 29th to give people like a map. Where can you go next? That's not just a one-time thing, but if today these 15 minutes in this checkup triggers more stuff for you or questions that you have, you'll have an array of options that you can connect to besides the person you spoke to that day. Another thing we spoke about was connecting with our organizations about creating a goodie bag of like stress relievers and little trinkets, right? That could keep us busy and kind of help with harm reduction and remind us of what wellness is so that we can have the continuity again. We did speak of being outdoors, since nature, right? And getting that fresh air and really enjoying the weather creates an environment and a space that gets us back out, right? As we've been in quarantine and we've gone through this experience in the last couple of years already, just really encouraging being outdoors and making it a friendly space for all of us to start getting acquainted again and seeing what it's like. Who are we, right? Who are the providers in our community that can support and be instruments right now for those that come forward, and making it a safe space.
Good, thank you so much. Does anyone else want to say anything about that? I know, Sarah, you were there.
We also talked about you maybe even having follow-ups after that first day, and what that could possibly look like. But it's just a really great opportunity to think about how we can be creative to really making an open invitation and a welcoming experience for everyone in the community. And Angelica, as you said, people that are working, first responders, mental health providers, really making it all inclusive.
Yeah, thank you. Definitely. Does anyone have any comments, any questions about that? Any input?
I do have a question. I saw this on a brief agenda that came out this afternoon. And So I'm just not clear on what the mental health checkup day is going to be. Is this for individuals to come and have like a quick screening? Or is this, are we talking about like the broader community, like doing a broader checkup?
Yeah. So initially what I thought about was to have like one day where every agency in the city offers a 15 to 20-minute mental health checkup. You know how you get your physical every year, they go to the doctor. So every year we should get a mental health checkup. And of course, because of the stigma, because of, limited resources that a lot of the agencies have, and the insurances, I don't know that they'll pay for it right now, but I think Kathy actually talked to me about yesterday about maybe encouraging the insurance companies to do something like that. So on the 29th would be our launch. So we might do some mental health checkups on that day, but what we're hoping to do is say, so plan it. So in July, we're gonna have the citywide mental health checkup day and, promote it, have TV ads. So on the example, the July 15th, anybody in the city can go to any agency and get a free mental health checkup. And from that, you might want to be referred to counseling, you might want to be referred to other things, because what we're thinking about is preventing a crisis, right? And the way to do that is to have your mental health checkup before you get to the point where you need a crisis counselor to talk to. So that's where that train of thought is coming from.
I see. Okay, perfect. Thank you. I love that idea.
You're welcome. You're welcome. Thank you. Kathy.
I was going to say, I have a couple thoughts. One is, yes, Councilor Govan, what you said, I was thinking about how over time, not for this year, obviously, but over time, could there be some advocacy with the insurance with providers? Because we do have annual physicals paid for in our medical world. And so can there be an annual physical preventive? So much of what we talk about is behavioral health is reactive, not preventive. It's not well care, it's sick care. And so can we focus on sort of well care and reimbursement for an annual visit is one thought. How do we galvanize towards that in the future? I guess the other thought that I had, and this also came out of the roundtable yesterday with the First Lady from New York when we were Charlene, when we were talking about community coming together. What am I trying to say? I guess it's what happens after the checkup, and do we have an opportunity with this committee that you're chairing to do that differently? And so I'm thinking if all of the agencies and providers are showing up, and okay, so one goal that we have in this day is to destigmatize. Right, one goal in this day is to say it's normal. Let's talk about mental health. It's comfortable. It's okay. And so it may not be any more than that, just getting the community to continue to talk more about it and know that it's normal, it's okay, nothing to be afraid of, number one. But number two, if after we then meet with an individual for 15 or 20 minutes and we realize that they need something more, I'm wondering what the committee thinks about what should we all be prepared with for the what next. So, and I would love, my dream, again, maybe we can't make this happen for this year, but that this could provide a launch for some sort of cross-agency referral pathway to say, Gandara has these services. I think you would be a great match over there. ADMA has this support. Let's see if we can get you into their pathway. And I think Chelsea and I were actually just talking about this last Friday, now that I'm remembering, but this idea of like a centralized wait list where families don't have to sit on 15 wait lists, number one. And number two, that it's not about, oh, I'm at BHN and you need to come to me. No, like how do we come together differently and get people to the right service at the right time that meets their needs? And so I guess I'm going to stop talking, but I think that in particular about June, as somebody who would probably be there doing these mental health checkups, that's my most pressing question is, what do I do with them after the checkup? If because a lot of people are going to need follow-up. What's our plan?
Can I say something about with that, Zaida?
Go ahead, Pastor.
I was in the greater Boston area for a long time, and there was a college, William James College, that had a thing called Project Interface, and it was a referral system that people could call, like, who need services, and they do the heavy lifting of finding which agencies took which insurance, which agencies had availability. And so towns actually would pay to have their town have access to exactly what you're talking about, Kathy, sort of a central referral source of people that would follow up, that, you know, that's their job, is to take the information, find out what's available, and then call back. So it is something, at least I don't know if it's been done on like a Springfield sized scaled size, but in the towns of Metro West Boston that existed, and it was wonderful for my clients when I needed to help get them more care.
Thank you very much. That's it can be done. Ayanna Crawford, please.
Thank you, Counselor. Really quickly, I wanted to also add to some of the conversation. I recall my mother being a psychiatric nurse for the VNA for many, many years, and hearing about some of her clients that she worked with, and some of the basic things that they needed was their home to be cleaned, right? For food to be in their refrigerator, and for them to have a moment where they can sort of be in a space that was not so conducive to all the noise going around. So I'm wondering, when you talk about the referrals and you're meeting with the clients in terms of your mental health sort of checkups, could you immediately give them some resources immediately to utilize, whether it's someone that could come in and clean their home, because their spaces, and especially when my mother would talk about, you know, their homes would just be in disaster. And so those are the needs sometimes that people just need, a really nice, beautiful space. You know, maybe they need some food, maybe they need some of those initial things immediately, and then sort of think about sort of those other things that they might need physically. So I just wanted to kind of add that piece because it certainly is important that people have a nice place to be and to feel, especially when you have children and the chaos with that. So I wanted to sort of add that. And even just, I want to call it maybe, you know, rent a friend for the day to just come in and clean up your home or do some grocery shopping for you, especially with the elderly population as well. And we know the elderly population, which my mother worked a lot with, you know, they have sort of these episodes, all right, the depression and all of that. And so having someone that can help them through the day or the week or what have you. So I just wanted to throw that out there. Thank you.
Thank you very much. Nicole?
I just want to second everything that Ayanna's saying about the whole, like, taking into consideration about the culture of the person that we're dealing with and what their prioritized needs are, because that really is, I think, key for a lot of families. We're not recreating the wheel here. Like, we have some of this stuff. Families don't know where to find it. We have people called care coordinators who will give them these sort of services, who can find these sort of resources. And same thing with like mentors. We have peer mentors, we have parent mentors. We have these things, but I think people don't know where to get them. I think people don't know how to access them. I run into people daily in the community who are like, if I could just figure out how to take care of my electric bill, then I wouldn't be robbing Peter to pay Paul, and then I could deal with this and get my kids to the doctor and do this. So like, we have to look at the family unit or the individual unit as a whole, and not just like, oh, well, there's a mental illness or there's a struggle or whatever, because it goes so much deeper. So what are they stressing about? Are they stressing because they don't know where they're going to live tomorrow? Are they stressing because they don't know how they're going to pay their bills? Are they stressing because they don't know where to eat? Like, so I second everything that Ayana is saying. And I just want to say, like, we're not recreating the wheel because these things are here. We have to get the information out that they're there and how to access them because it is available.
Exactly. And that's something the United Way yesterday presented this little, like a big keychain thing with all the resources on there. So Nicole, you might be instrumental in helping us to get those resources, to find out what they are so that we could include them in this goodie bag that we're planning on giving out. And all of us, because all of us have resources and we know things, you know, that we need to be able to share. Yes, Cynthia.
Yeah, just to piggyback on what the two ladies previously said, Ayana and Nicole. I know that we're all passionate about this, and we certainly want to see our community, you know, heal or get better or whatever the case may be. But I think sometimes, you know, we let our zeal to help, you know, sometimes get ahead of us organizing, right? And creating a system that won't be more complicated or adding to the complication or the complexities, you know, of these services. So I'm finding out since I made the switch from higher education to mental health counseling, although I got my degree years ago, I'm finding out that counseling is really more therapy. That is not as much counseling as it is therapy. And what I mean by that is, Nicole just said, we have all of these services, we have all of these resources, and here I am, a practicing counselor, a practicing therapist, and I don't even know where all of those resources are, let alone, you know, certainly the families don't know, but I don't know. So, you know, and so with me not knowing, that's creating more of a problem in the community, right? So if they do happen up on me and the service that I provide or whatever, if I'm not informed enough to know what we have in the community as a resource, you know, to help this family get back on track or to stabilize or whatever, again, the system is just going to continue to be broken, and broken. And so I'm a little concerned about we're trying to kind of put the cart before the horse, if you will. And I just really think that we should probably start by organizing us, you know, bringing all the resources together, us, you know, getting a better understanding of what we have and what we don't have, because we do know that the city don't have enough resources in the field of mental health as well. So like I said, I'm a little concerned only because I'm imagining me, if I found out, you know, about this mental health checkup and I went and, you know, and I'm like, whew, some relief for 15, 20 minutes, what's gonna happen at the end of that 15, 20 minutes? If I need something that we don't have, or if I need something, I'm talking to Kathy and Kathy don't know about it. So I'm gonna end up being more frustrated, you know, whatever the case may be. So I'm not trying to, you know, throw any water on this fire, or whatever the case may be. That's just the input, you know, that I have. And that's just the energy that I'm bringing. I really want us to do something. And I want us, you know, to get it right the first time. I don't want us creating more frustration, you know, for us, the professional, and I certainly don't want us creating more complications and frustrations for the families and the residents of our community that we're hoping to reach and to serve.
Thank you for that. Kathy?
Thanks, and thank you for that, Lady Swan. I totally get, we have limited opportunity to interface with people, and if we do it poorly, then that's going to negatively impact their willingness to engage in the future. And I think going back also to Nicole, what you were saying about let's not reinvent the wheel, and also Councillor Govan, what you were saying about the available resources. So I wonder if some work of the work group or the subcommittee, I don't know if it's the same work group that has already met or we add people to it, can create some sort of materials that has, I guess what I'm thinking about is the list of resources in the community, but not the full list, but contact information, right? Here's the website for the Mass 211, and here's the website for 413 Cares. And these are the kinds of things that you can find out about it. But I'm wondering if we also, to Nicole's point, if we want to think about some easy eligibility screen, if you will, for care management programs. So, because I think there's going to be so much value in being able to say to most everybody that we screen, here's a care manager that can follow up with you to help you, if you want, get connected to these services. And so a family with Mass Health with a child under the age of 22, let us connect you with the ICC program so that you can get support, finding your social needs, meeting your social determinants needs and such. I guess I would love to see some sort of materials and packet that we all have the same thing and we're all giving out the same thing. And I'd be happy to participate in developing that if it's helpful.
So just so everyone knows, the next planning meeting is June 9th. And I'd love, Nicole, for you to come. Anyone else who might be interested in joining us to put this together, but that's exactly what we were talking about, is putting a packet together of resources, of information, maybe even, how they do the little trial size, soap and shampoo and stuff like that. But that's what we're going to talk about in the planning group. Go ahead, Angelica.
I was just going to add to this conversation that, as I'm hearing everyone speak, we're talking here about a journey, yes. And so coming from, I've had my only job, my longest relationship has been at DCF. I have had, but from an internal perspective, the luxury of all these services that we're saying are needs, but it's a reaction to when the problem already exists, being able to provide them and connect. Yes, they do exist. So I'm very familiar, but from an internal perspective. So I hear you, Lady Swan, when you say, if we all don't know it. So how do we, I guess in my vision, as I hear everyone, because it's so needed, it's like Maslow's theory, when we meet someone's basic needs, then we can get into, right, the continuity of wellness. So yes, it's all important. But what I'm thinking is, how do we get these services to service our community before the department is involved, before someone's filing, right? Eventually is what we're working towards. And yes, as we gather this work group and create this list, my vision would be that everyone gets it. So we can provide these informations as a collective and with equality, right, to everyone. So not one therapist or one provider over another has the information, but making a master list of these services that are willing to be involved before the department has to make that referral, right, in our community. And I'm not sure that I see a lot of that in the before part. Because of my lens, I'm seeing the reaction. But how do we then eventually, and we're the ones, right, as first responders that are going to be meeting with our families and children across our community. So we should have that list and see who can provide the housing services, helping someone clean their home. Sometimes we do it as social workers, like, come on, we're not just going to tell you it needs to be clean. How can we plan one small task at a time? It's really carrying them through and being an instrument. So if we have that list of people and providers that can do it outside of the problem being identified and it being government kind of ran, it would be nice, because then we're addressing what we need from the foundation from both ends, and then everyone would have access to it. And I'm happy to continue working on developing that with everyone else.
That's great. Thank you so much. Thank you. And this, of course, this is just this one piece. This is not what the Mental Health Committee is doing, but this is one thing that can come out of it, is the mental health checkup that the insurance companies are going to pay for every year. And then, like everyone said, once you get the mental health checkup, now what, right? So now we need Maybe they might need a therapist. Maybe they just need someone to clean their house, like Ayana said, you know. So those are the resources that we're going to be looking for, and we're going to make sure that we have. I really love the idea of having a referral source where all the agencies have access to it. I know that BSAS has that. The Bureau of Substance Abuse Services has a database that you could look into and see where there's a bed available in this whole state, right? Of course, there's not enough of them ever, but hopefully we'll get to a point one day when we do have enough beds, we have enough therapists, we have enough resources. And I'm really glad that State Representative Orlando Ramos's office is here, because at the state level is where we're going to talk about having insurance companies pay our clinicians enough so that they could stay in this field, right? Because that's another problem we talked about yesterday. The clinicians that graduate with a master's degree, they're maybe making $40,000 a year to start with a master's degree, right? So now you have to pay back student loans. You can't afford to pay back student loans when you're making $40,000 a year, plus you're taking care of all your other basic needs. So we have a lot of different avenues that we need to tackle, and that's one of them is the insurance companies, the resources, the agencies that are in this city all are doing some great work. And what we need to figure out is a way for us to all work together to make sure that there are no gaps. You know, like Kathy said, the wait list, if my agency has a wait list of 20 people and you need clients, I don't know why we can't send 10 clients over there, right? We need to keep it simple somehow. And I really love that the First Lady of New York basically said that is collaboration is the only way that we're going to do it. So I'm really excited about this. Does anyone else have any other comments? Good. Barry, did you want to say something? I saw you come on. No, he's muted.
Yeah, so no, I am more interested in listening, but thank you for the offer.
Well, thank you. Thank you so much. Okay, so we've come to a point. June 9th, like I said, is our next planning meeting for the mental health checkup day or checkup launch day. Because what we're planning on that day is to just launch it. And what I did actually prior to the meeting that we had was to reach out to the Health and Human Services Department and ask them if they had any funding that we could access to do this work, right? Because like I said, right now the insurance companies aren't paying for it. The staff time that it's going to take for us to do a mental health checkup, 15, 20 minutes, that's staff time that, you know, agencies have to pay for. So Commissioner Helen Carlton-Harris was very excited about it. She was in agreement with it. And hopefully they're looking for some money for us to do it because that's the key. So I also reached out to our Mayor Sarno, and to see if he might be able to support us. And I'm waiting to hear back from him. So, okay, anything else? Anybody have any other questions? Another agenda item.
Yes, Zaida.
Yes, go ahead, Councilor Allen.
Yeah, thanks. Could you just review I've been listening to the commentary and stuff. It's great. Could you just review the dates? I missed the last meeting, and I heard the date about next Thursday, a committee meeting. I can't make that, but what are the dates of the checkup? I missed that.
Oh, that one, the launch, we're planning a mental health checkup launch day. And that's the day that we're going to launch the initiative. And hopefully going forward, every month, we'll pick a day where every agency in the city will have a mental health checkup day. And that day is June 29th.
June 29th.
Yes. And our planning meeting for that is going to be on the next one is going to be on June 9th at 9 o'clock, and it'll be on Zoom. And I will invite everybody to it. Anybody that's on this list, if you can attend, that'd be great. We would love your input. I really would love Nicole and Ayana to come on, especially people that if you have resources that we can share with the community, share with the clinicians, because like Lady Swan said, some of the clinicians don't know all the information. I don't know all the resources that we have available in this city. And then that brings me to our next point. Our next meeting is supposed to be on July 7th. And I was wondering if you all thought that the summer was an okay time to meet, because I know a lot of people go on vacation. Should we postpone our July and August meeting and then recoup back in September for the mental health committee I'm talking about? What do people think about that?
I think we keep going. That's just me, because I think the momentum is important, and I think the mental health issues aren't getting any less. So I don't think the mental health issues in our community are taking a break. So, but I also understand that we need to take care of ourselves and take breaks so that we can continue the work in the long term. So I would go with whatever the committee decides, but I'm certainly willing to participate through the summer.
Right, great. That's really good to know. I wouldn't mind either. Okay, so our next meeting, Councilor Allen, were you going to say something?
No, I just wanted those dates. Yeah, relative to meeting in the summer, it's always, I think it's usually good to keep going. It's just that, I mean, I know I won't be able to make all the meetings in the summer, but I think it's good to keep going.
Yeah, and it's fine. Not everybody can make every meeting, and that's okay, but I really do like the momentum. So our next meeting is going to be on July 7th. And I really would love to have these meetings on person. I love seeing the facial expressions, the body language that we all can look at when we're in person. So I'm hoping that it will be in person in July. If the COVID numbers, the only reason we're on Zoom today is because the commissioner's suggestion, because of the higher numbers, she suggested we go on Zoom, so that's what we did today. But I'm hoping if we can do it in July, on July 7th in person, that would be great. Kathy, would your place still be available for us? Okay, so
absolutely, yes.
Great. Yes, so July 7th is the next mental health committee meeting, and I will have the city council staff send out that notification with where we're going to be in person. Beverly will type up these minutes from today, and then we'll send those out as well. The next mental health checkup day planning meeting is next Thursday at 9:00 in the morning, and I will send out that link to everybody so that we could be on Zoom and continue planning that day. We're looking for resources. So if your agency, if you want your agency, if you're going to be there on that day, you could bring out your own, they call them chopsticks or whatever, little gift things. So if you want your agency to participate, we would love to have it. We would love as many agencies as possible. And the reason that I said I love that Orchard Covenant Church is here today is because yesterday we talked about that in the meeting with First Lady from New York, and that the churches aren't really involved in mental health, right? And I don't know if it's a taboo that they don't talk about it or they're not involved with it, but I'm really excited that Pastor Munn is here and that we're going to be starting hopefully to bring more churches into the discussion. Okay, so at this time, are there any questions, any last minute comments before we take off? I'm sorry, you came in late, 530-1167, but thank you for coming. No, well, if that's the case, we could end early, 6:48. We're doing good. You guys have a good night, and thank you so much again for being a part of this conversation.